So I'll try to be hopeful. The question is, what can we actually do to improve health systems? What can we individually do? Every one of us is part of the health system. There are individuals in this room who provide care, who teach, who have governance roles, who have a bit of all. Other people work outside of the health sector, but they're focusing on determinants of health. And we've all been patients. So we can also think about our own roles individually. And also, at the very least, we are voters. We all vote. And I thought about that this weekend. The MSF hospital in Kunduz was bombed in October last year, and MSF has asked that the bombing be investigated by the International Humanitarian Fact-Finding Commission. But this cannot proceed without the consent of the Afghan and US governments. And I thought about it, and I thought, well, I'm American. Why haven't I not contacted my congressperson? Why have I not contacted my senator? No doubt the political situation in the US is a complete mess right now. So I'm not naive. I don't necessarily think that anything will happen, but it's only going to cost me 5 minutes of my time to contact those people. So why haven't I done it? We are all voters. We all live in a democracy. We have a small part to play. But also, I think we need to think collectively, institutional level, regional level, state level. This past week, not only was it the World Humanitarian Summit, but it was also the World Health Assembly, which is the annual governing body meeting of the WHO. And usually these kind of meetings are relatively boring. People spend a lot of time debating over the placement of commas and translations in resolutions. But exciting things happened this week as well. There were resolutions passed on strengthening the international health regulations, which govern disease surveillance and response. And we have a new global strategy on human resources for health, which looks at attaining the SDGs through better workforce planning. So just to conclude, building a resilient health system is very, very complicated, and it can seem overwhelming. But if you start breaking it down into the constituent parts, then it becomes much more manageable. But as long as you have strong leadership and stewardship to overlook the whole system. Thank you.